All right, today's a big day for John. He's went through the 8 weeks of our comprehensive treatment plan on his knee. Today is the big day where he gets the stem cells. And John was a really neat case. I want John to just share with you kind of where his journey with his knee started. It was like 3.5 years ago, you're telling me?
About 3.5 years ago.
And so your first step when you started having knee pain, where'd you go? Where'd you?
I go to the doctor in Ames, Mary Greeley, McFarland Clinic. Went
Yep.
to who's the guys that take care of joints?
Oh, the orthopedist.
Oh, yeah.
Mhm.
Yep. And so he gave me he said, X-ray, he said, you don't need a knee replacement or anything coming up like that. We'll give you a shot of cortisone.
Yep.
Which, oh God, that was great. I felt like I could play basketball again.
Yep. And that was the first one.
Yep.
Mhm.
And I got them every 4 months for a year. That worked that good.
Mhm.
And then it dropped down. It was good for about 2 months, and then it was good for about 2 weeks. Well, it's time to try something different.
And that's pretty typical. So, like what I was telling John before this, is that is a typical path for a lot of people. They'll go get cortisone shots, and the first one might give them a lot of relief, and then each subsequent one is less and less and less, and they become frustrated and start to look for alternative solutions and options. And that's where John actually went next. You actually ended up in a holistic office back in the Ames or Des Moines area. In Des Moines area. And the way you're describing it to me is they were doing a lot of just traction on the knee and opening it.
They put it in the machine and they just pulled it out, stretched it out.
And they did some adjustments. So it was a chiropractic office.
Yep.
So again, but the results were kind of limited there as well.
I always felt good when I walked out of there, but by the time I got home, my knee hurt just as bad as it did when I came.
And now he's been with us for 8 weeks. And how are you doing?
Up until a week ago, I was doing great.
Right.
Yeah.
He was doing some exercises and
and Kanan had me doing exercises, and I was getting really good results. So then he was saying, well, if you do more reps, it's going to get stronger faster. So I was maybe pushing a little more than I should have.
But overall, so before a week ago, how were you doing?
Great.
And here we are, big day. You excited about this?
Well, we'll see.
We'll see. Yeah.
I don't like shots.
Yeah.
You remember that.
Yeah. So that's also very common. People aren't really excited about the shots, but Jan is fabulous. You can see in the background, we got the ultrasound, so she knows exactly where she's going. And I think it's going to be good. So we're excited for you, John. We'll check back in with you in a couple months and make sure things are going great.
Yeah, I hope they are.
I think they will be.
Good.
Right.
All right.